Greetings, friends of YouTube. Old Guy here. In this episode, you will learn about the Medicare Part D donut hole. Not everyone spends $4,660 on prescription drugs, but when you do, your out-of-pocket expense goes up. Grayson will share with you his tips to manage your benefits before you reach the money pit. Thank you very much, and on with the show. First things first. I have no medical credentials whatsoever. I will tell you what works for me. You should consult your healthcare professionals before following anyone's lead. Please stay with me to the end to see what you can do to stay out of and if you fall into the donut hole. If you find value in this presentation, please like and subscribe. Comment on topics you want information on for future videos. In 1969, my freshman year of high school, I took a class called General Business. Mrs. Anderson shared with the class what turned out to be one of the most profound lessons of my life. Social Security is meant to be a safety net. You need to plan to retire and save for it. Do not allow yourself to believe that Social Security will sustain your retirement by itself. The lady was spot on. Too bad Mrs. A didn't foresee what Medicare would become. Medicare began in 1965, originally for people 65 and older. Major revisions occurred over the years. The Medicare Modernization Act of 2003 establishes a prescription drug benefit available to all Medicare beneficiaries. Beginning in 2006, Part D replaces the Medicare Plus Choice program with the Medicare Advantage program, making additional types of private plans available and substantially increasing the payments to those plans. A massive expansion came with the Affordable Care Act, which strengthens Medicare coverage of preventative care, reduces beneficiary liability for prescription drug costs, and institutes reforms of many payment and delivery systems. Let us begin with the deductible. For 2023, it is no more than $505. Translation: your plan may vary based on the benefit structure of the plan. Good to know when you are shopping for a plan during the enrollment period. My plan began with copays this year, no deductible. Initial coverage begins after the deductible for your plan is satisfied. Copays are set by your plan, most likely separated into tiers. A call to member or customer service can give you the copay and the retail cost for particular drugs. The donut hole split coverage of prescription drugs. Nicknamed due to the beginning from the outside you move to the center. At initial coverage limit, the rules change. They change again when you get to the catastrophic limit. The math was very complicated but was streamlined in 2020. For 2023, the initial coverage limit is $4,660. The second is a catastrophic limit of $7,400. Regardless of where you are on December 31st, it begins all over again on January 1st of the next year. As a diabetic, I got first-hand exposure to the dramatic differences in my copay expense. Even though I was on an Advantage plan, the donut hole applied to my benefits. 2 drugs, Tresiba and Jardiance, were working for my body but against my wallet. That initial coverage limit I mentioned, you get there because the cost of the drugs is counted at full price, not what you pay. The limits amounts changed for 2022, but my cost jumped from $80 a month to over $320 a month for these 2 drugs. Presently, upon breaching the $4,660 limit, your copay changes from a flat fee to 25% of the full price until you get to the $7,400 limit. Above $7,400, the copay drops to 5%. If it is a very expensive drug like Humira, it can still be very costly. According to GoodRx, a 1-month supply can cost $9,091.86 on average. 5% of retail is $454.59. For example, Tresiba, currently priced on the internet at $152.15 per 3 milliliter pens. That's 100 units per milliliter. Cost at my current consumption of 1,200 units per month is $608.60. In 2022, my copay was $40 a month. Not sure what it would be now, but my cost would be a quarter of the full price of 4 pens. $608.60 times 0.25 equals $152.15 when in the donut hole. GoodRx lists the average retail for Jardiance 30 tablets at $681.64 at the time of publication. As you can see, $4,660 doesn't last very long with $1,290.24 a month subtracted for just 2 drugs. My portion is $322.56 when in the donut hole. I have other prescriptions chipping away at that amount too. What can be done about it? According to the National Council on Aging website, some, but not all states offer a State Pharmaceutical Assistance Program, SPAP. Benefits are not uniform. Check for what applies to you. Patient Assistance Programs. Manufacturers may offer low or no cost assistance. Qualifications can vary. Disease funds are offered by charitable groups. Check to see if any are available to you. Check with your healthcare professional to see if generics are a viable alternative to more expensive brand name products. In addition, your healthcare professional may have samples you can receive, usually for free. These have no effect on the numbers Medicare tracks. Use discount plans or manufacturer programs to pay less for the most expensive drugs to keep out of the donut hole, as these purchases are not applied to your initial coverage limit. By remaining in the initial phase, my copay for a lower cost drug is $0, but could have been $16.50 if I had entered the donut hole. How do I get out of the donut hole? By Medicare's rules, the above options may not record your expenses to get you to the other side of the hole. You can spend your way to the $7,400 limit, or you can endure it until the calendar year ends. Then there is Extra Help, which is a federal program that helps pay for some to most of the out-of-pocket cost of Medicare prescription drug coverage. It is also known as the Part D Low Income Subsidy. There are strict income and asset limits that have to be met to receive assistance. I would like to take a moment to thank our siblings, past, present, and future, that defend the Republic, and those that serve the public. Thank each and every one of you. If you found value in this video, please like and subscribe. Ring the notification bell if you want to know when the next video is published. Please leave your questions and comments below. Y'all come back now, you hear?